Hello, today I'll be discussing about subjective refraction. All of you know that we do retinoscopy, that is objective refraction. Now, before prescribing glasses, we need to do a proper subjective refraction. So, the concept of subjective refraction is very important to know. You need to know how to do a proper subjective refraction. Then only you can exactly prescribe the proper correction to the patient. Now, coming to the principle of subjective refraction, the purpose of subjective refraction is actually to determine the combination of spherical and cylindrical lenses necessary to artificially place the far point of each of the patient's eyes at infinity by subjective means. That means my aim is to place the far point of the patient eye at infinity. Okay, that means what? We need to relax the accommodation, completely relax the accommodation. So we can give maximum plus lenses and minimum minus lenses to completely relax the accommodation. Okay, now subjective refraction does not mean you are seeing something in autorefractometer and putting it and seeing in the trial frame, trying and asking the patient whether this is better or that is better. It is not like that. Subjective refraction is a completely different concept, right? You need to give the patient adequate correction so that his accommodation is completely relaxed. Otherwise, wearing the glasses, he will get asthenopic symptoms, he will get various other problems. Okay, so if the accommodation is active wearing the glasses, so the purpose is not solved. So how to do that will come step by step. For relaxing the accommodation completely, we do fogging. Now, how to do fogging? Fogging is a term all of you have heard, right? Fogging is a term all of you have heard. We need to fog the patient to give the correction lenses. Okay, so let me talk about it. Now, while doing, please listen very carefully, while doing objective refraction, what we are doing, we are placing the working distance lens in the trial frame, right? You cannot block any eye. So in front of the right eye you are placing, suppose your working distance correction is plus 1.5. Okay, so in front of the right eye you are placing 1.50 and in front of the left eye also you are placing plus 1.50 in the trial frame, right? Now put the trial frame with those working distance lenses into the patient's eyes. Give the patient a 6 by 60 target to look at. Okay, not the point light or something. Why 6 by 60 target? His accommodation needs to be relaxed. Now you have fogged the patients adequately by placing plus 1.5 in the both the trial frames, both the trial cases, right? So that you need to keep in mind. You cannot remove that plus 1.50 working distance lenses. Now what you are doing? You are doing objective refraction. You are doing your retinoscopy, right? So whatever value you are getting, now what you will be doing? You will not remove the plus 1.50 working distance lens. That is the concept of fogging basically. Okay. Now to do subjective refraction, you need to perform each eye separately. You need to perform subjective refraction in each eye separately. What you can do after doing your retinoscopy? So while doing retinoscopy, plus 1.50, what it is doing? It is relaxing the patient accommodation, right? So you will not get a varying reflex or sort of, so it is relaxing the accommodation. Now during subjective refraction also, adequate fogging like this, it will relax the patient's accommodation. right? So fogging is a technique to make the eye artificially myopic by adding enough plus lenses in front of the eye to make sure that the accommodation is relaxed. Now the entire image formed by the eye's optical system will be located in front of the retina. That means you are making the patient artificially myopic, right? So both, like if the patient is having astigmatism, whatever it is, so my aim is to make the entire image in front of the retina. Okay, horizontal meridians also and vertical meridians also. So completely I will fog the patient, that is my aim. Okay, now we will start defogging slowly. So kept the working distance lens plus 1.5 in front of the right eye. Left eye is covered. We are doing the subjective refraction from the right eye. So now slowly reduce the plus 1.5 fogging diopter lens by 0.25 steps till the patient is reading 20 by 50. Remember, 20 by 50. Okay, so 20 is a 6 by 6, right? 40 is 6 by 12. So 6 by 12 partial the patient will be reading. So at that point of time you need to stop defogging the patient. Now let me talk about refraction with no astigmatism. If the patient is not having astigmatism, it is very easy to perform subjective refraction. Simply the same way you are doing, you are defogging by plus 0.25 diopter from the working distance lens till the patient's vision is 20 by 40, and then reduce the power until clear vision is obtained, that is 20/20 or 20 by 15. So the patient basically is reading the 6 by 6 or 6 by 5 line under adequate fogging conditions. Slowly you are reducing the fogging lens by 0.25 diopter and the patient has read the 6 by 6 or 6 by 5 line, right? Now you are not giving any stress to the patient. Patient is completely relaxing the accommodation. Why? Because you have placed the fogged lens in front of his eyes. So that is the reason. This way basically you can give the best corrected visual acuity to the patient. This is a refraction with no astigmatism. That means the patient is not having astigmatism. Now, if the patient is having astigmatism, then what to do? Astigmatism means both meridians, the patient will be having unequal amount of refractive error. Okay, the horizontal meridian one refractive error and the vertical meridian another refractive error, right? So astigmatism, patients with astigmatism, dealing them, it is really a matter of challenge. Okay, so to understand astigmatism, you need to understand the concept of Sturm's conoid, the circle of least confusion. So Sturm's conoid means instead of a single focal point, there are two focal points separated by the interval of Sturm. I will explain by the diagram. And circle of least confusion is the closest thing to point image for a point object for an astigmatic eye. It is located at the dioptric midpoint between the horizontal and vertical focal lines. Now let's come to the concept of Sturm's conoid and circle of least confusion. See this diagram. This is the vertical meridians, right? This is the blue one is a horizontal meridian. This is the patient's cornea, right? So in case of astigmatism, what will happen? For the vertical meridian, the rays of light will focus it at some point, and for the horizontal meridian the rays of light will focus at another point, right? Basically it is forming a cone, right? It's not a sphere like, right? So the vergence of light you can see, okay, because our cornea is not spherical, right? So the vertical meridian, it is the vergence of light is focusing on focus 2, suppose, and the horizontal meridian, rays of light from the horizontal meridian is focusing at focus 2. Focus 1 the vertical meridian and focus 2 the horizontal meridian. Now this is called the focal interval of star. From the distance between focus 1 and focus 2 is the focus 1 and focus 2, it is the focal interval of star, right? So that means the point where the vertical rays of light are focusing and the distance between where the vertical rays of light are focusing and where the horizontal rays of light are focusing. So that is the interval of star, right? So this completely it is called the Sturm's conoid. Now what we'll be seeing? Now where will be the end point? To find the end point we need to consider circle of least confusion. See here, this point, suppose A, here only the vertical rays of light has moved this way and the horizontal rays of light are not meeting, right? So it is, if we draw a circle at this point, it will look like an elliptical circle A, right? This point B, it is just a horizontal line, right? Why? Because only the horizontal meridian it has worked, right? A point, some horizontal meridian and vertical meridian, that has not met. Both the vergence is present over here. Here B point, only the horizontal vergence of horizontal meridian is present, right? Now coming to the circle of least confusion. Circle of least confusion means where the vertical vergence of light is meeting with the horizontal vergence of light, and now there is a complete circle formation. You can see C. This is the circle of least confusion. That means equally the vertical rays of light, vergence of vertical rays of light and horizontal rays of light is there at this point. So this is the circle of least confusion. Okay, so our aim is to bring in case of patient with astigmatism, we need to form the image at the circle of least confusion, basically. Okay, we need to reach the circle of least confusion. Okay, now you can see this D, only the vertical vergence is more, so that it is elongated, this circle is elongated. E point, okay, there is no horizontal vergence, so a vertical line is there. F point is also a elongated vertical line. So our aim is to reach this circle of least confusion in case of astigmatism. So this circle of least confusion is the closest thing to point image for a point object. It is located at the dioptric midpoint between the horizontal and vertical focal lines. That you need to remember. Okay, so this is this lecture I have given from the reference book is the Primary Care of Optometry, okay, by Theodor Grosswener. Okay, you can read this book. It is a very good book for developing the concept of clinical refraction. Okay, in the next lectures I will be discussing more about subjective refraction. Thank you.